Hi, my name is Ben Muke. I'm a student nurse practitioner at Warden University. Here goes my ID. Today I'm going to be talking about a patient who is suffering from cocaine abuse. AA is a 21-year-old Caucasian male who's also a freshman at Georgetown University. He was admitted in the hospital in December. AA was, according to the ER report, AA was found at the metro station, very confused and very agitated. When the police tried to interview him, he was very delusional, very talkative. He was transferred to the ER where he was treated for cocaine abuse and then stabilized, and then transferred to the psychiatric hospital where I work. Cocaine addiction continues to be an important public health problem with over 1.7 million users in the United States. Although there's no approved pharmacotherapy for cocaine abuse, for cocaine addiction, there have been several medications that have been tested for the treatment of cocaine abuse. According to Prenti in 2011, antidepressants were used because of the high occurrence of symptoms of depression among chronic cocaine users, and they exert a modest beneficial effect. Pani in 2011 also suggested that concomitantly with psychotherapy, with pharmacotherapy, psychosocial treatment could also be beneficial for cocaine abusers. For AA, I'm going to use cognitive behavioral therapy. In cognitive behavioral therapy, the individual will learn to identify and correct problematic behavior by applying a range of different skills that can be used to stop drug abuse and to address a range of other problems that often occur with it. That is, enhance the patient's self-control by helping them develop coping skills and to help them to cope with the cravings so that they don't fall back on the cocaine use. Additional information that might potentially affect the outcome for AA's treatment is the fact that his mom is a heroin addict, and she's been on the methadone maintenance treatment for years. Also, several students from AA school comes to visit him frequently. According to research, several cocaine use is very, very rampant on university campus. Research portrayed that 15.8% of college students reportedly use illicit drugs such as marijuana and cocaine, and mostly they said was for academic purposes. Increased drug use among students puts AA at risk when this continuous interaction with his friends from school. Because my recommendation would be that because AA have to receive this visit, his visit should be monitored and controlled. For his treatment plan, which is the roadmap to his recovery, which is going to help AA to be focused and to have a purpose. He verbalized his goal to stop drug use and to return to school in the fall. AA attends Narcotics Anonymous, and he also attends cognitive behavioral therapy twice a week for 2 hours. He takes his medication and he develops his objectives. The objective is going to be for him to develop coping skills, for him to participate in his treatment, and for him to have support. Using the Prochaska and Declan mode. When AA arrived at the hospital, he was way past the pre-contemplation stage. He verbalized that he was ready to go back to school. In the contemplation state, he needed help, but wondered how he was going to get this help. And so he had to receive counseling. In the preparation stage, with the test stage, AA decided to change. He said, I really want to work and change this so that I should not fail my mother. AA, in the fourth stage, AA exhibited change. He attended his groups, his therapeutic groups in the therapeutic learning center. He took his medication, and he also attended his cognitive behavior therapy groups. AA did not make it to the maintenance stage yet because you have to be in the treatment for 6 months to achieve that. He's been in treatment for 5 months. Again, we've not had any relapse, so he's progressing to treatment. So we'll continue to monitor him. Thank you.